Yes.
disorder
في شرط أصلي. فهي implied it's inflammatory. It's not inflammatory disorder. Yeah. It's degenerative disorder. Yeah. But the degenerative disorder will be inflammation. Yeah. It's not the primary pathology. Okay. فعشان هيك معظم الكتب الجديدة غيروا له arthrosis. Yeah. Knee arthrosis instead of knee arthritis. But still the two names يستخدم. بس مشان to make clear in your head why what's the difference between them. Yeah. Okay. Always we start the anatomy. Okay. And you have to revise the anatomy of the hips. Yeah. This is the anatomy of the hips. Yeah. Okay. You've got the labrum, you've got the scapula, you've got the head, you've got the capsule, the ligaments, yeah, and then you've got the blood supply. Okay, that's all you have to know. You have to know it. Okay, it's cartilage. Okay. Okay. Synovial joint, you get the synovial around it and the cartilage inside. What type of cartilage? Hyaline cartilage, yeah? It's a specific cartilage. And this will become the difference, we have to distinguish it completely different from the inflammatory disorders. Yeah? And here, rheumatoid arthritis or arthropathies. Yeah? Seronegative, seropositive arthropathies. Yeah? Okay. This is arthrosis, degenerative arthritis. So what's the primary problem with arthrosis as opposite to rheumatoid arthritis?
Rheumatoid arthritis infection, inflammation. And arthrosis degeneration.
Yeah, but what's the process? The process.
immune
The process.
immune
Rheumatoid arthritis is autoimmune inflammatory disorder.
Yeah. But which part of the anatomy in this joint both difference?
Arthritis synovial.
Exactly. This is the fundamental. Synovial disease. Synovial inflammation, and that causes the other problem. Then you get the cartilage damage. بينما arthrosis or arthritis, degenerative arthritis, what's the primary problem?
Cartilage.
Cartilage problem, degenerative the cartilage. Yeah? And that's big, important and big difference. Like inflammatory disorder, synovial, and then the synovial destroy the cartilage, and it's a cartilage, and then you get some secondary changes. Yeah? Pathology. Okay. طبعا دائما degenerative changes affect which joint?
closed joint.
Hmm?
اللي كثير بنشتغل اوفر يوزد.
ايه دكتور سؤالك؟
Which joint arthrosis affect as opposite to rheumatoid?
الاوفر يوزد.
Yeah? Yes? In other words,
Mechanical stress radial.
that's right. So it's a big joint. Yeah? The big joint tend to affect force. And it's mechanical. Yeah? And degenerative. فالبيج joints أو الجوينت عليها ضغط كتير yeah, will affect it more. Okay. بينما الروماتويد which joint start with mostly?
small joints
Small joints.
زي
Yeah?
الفرنجز
The hands. Yeah? The small joint. Can you see how the picture, how the medicine? It's a pattern of disease. You have to learn the pattern of disease. Yeah? Like, of course, then the age. Yeah? Rheumatoid arthritis can happen younger age group. And most of the degenerative arthritis happen in older. Yeah? It can happen in young with other causes. Yeah? Okay? So you have to look the age, the sex, the race, the occupation. Yeah? All these will affect the rheumatoid. Which one affect rheumatoid? Which affect arthrosis. I'm not going to go through it, that you have to read. I'm telling you what yeah? Occupation, obesity is a big factor in degenerative, yeah? Incubation has a factor, okay? Then you get the arthritis will be having with pseudo-arthritis when you get inflammatory, yeah? Then you get the secondary changes, like external dysplasia in children. It's not treated, خلال الولادة, it's not treated, will develop arthritis, yeah? That's the secondary, yeah? So it can be primary because it's natural process, because of the patients getting older and to use it, or maybe some other factor secondary to other primary problems like the DDH, yeah, like the Bell's disease. They have a primary problem, and that will cause secondary degeneration and early degeneration. Yeah, so these guys will have arthritis in younger age group, in the 30s, 40s, and 50s, as obviously the age-related would be 60s, 70s, 80s, yeah? Okay. Predominant, okay? And so this is the primary, and that's what we call primary and secondary. Secondary must be other causes accelerate the process. You know, that dysplasia, post-traumatic, yeah? Somebody has a trauma to his knee and damage the cartilage, yeah? He's going to have arthritis earlier ages. Okay? That's why athletes often have degenerative arthritis much earlier age than the normal population. So they could damage to their cartilage so often. Okay? وحكينا الانفكشن, the post-infection. Yeah? Because the cartilage get damaged secondary. Okay? Avascular necrosis. Yeah? So the head is the head. Sickle cell disease. What's the common vascular necrosis within Ordon? Alcohol is common in Europa. Nash alcohol.
Hypertension.
Why would be hypertension?
Atherosclerosis.
I think, yeah. No. No, secondary, no. Smoking will affect everything. It's not a big primary, secondary cause. نقول على avascular necrosis.
Diabetic.
عندنا سكل سيل أنيميا؟
Diabetic.
سنة. عندنا سكل سيل أنيميا؟ ما عندنا؟ كثير عندنا؟ كثير عندنا سكل سيل؟
مش كثير بس في بعض ناس.
مين سكل سيل تكون؟ إيه؟ لا. وطاقة. So وين راح تلاقي سكل سيل؟ بالضبط. بس. مش راح تلاقي عمان. هتلاقي بالضبط. بس very small. Bigger causes.
Diabetes.
Trauma not the cause. Trauma can cause yes, trauma. Largely is good damage to the head and dislocation.
Hypercholesteremia.
Steroid use.
Yes. Yes, why? Steroid use. Who's the common use of steroids? Huh? That's not use, that's abuse.
Traumatic chronic infections.
Oh guys, basic medicine.
Obstructive lung disease.
Yes, asthma and obstructive lung disease. البطش تبعتهم شيء.
Corticosteroids.
ستيرويد، البطش تبعهم ستيرويد وسبريتامول ودايليتر. لما يصير عندهم كرايسيس ويدخلوا المستشفى شو بعطوهم؟
Corticosteroids.
Steroids. Right. The steroids toxin is very common in the population. فطبعا post PDH وpost صوفي يا اللي احكي معاكم الدكتور شو اسمه شركة هذول للمرات المالية. فهي secondary causes. The symptoms yeah can you see we always look systematically. You start with anatomy, epidemiology, presentation, history, examination, yeah? Okay, symptoms, hip joint pain, that's a common symptom. So pain is the common symptoms, yeah? A groin pain in the hip, because the hip is the groin. Common mistake, people think this is the hip. No, the hip is here, the hip joint, yeah? Okay. Patient start limping, yeah, because of the wajah. Okay, so you get allergic pains, okay? Then you get stiffness. لما يجي يتوضا ويتحرك يعني بيقدرش يرفع ايده على الوضوء ولما يقعد بيقدرش اسمه هذا difficult. Then when it gets severe, start getting pain at wrist and pain at arm. Yeah. So this is the progression. So these are the symptoms. Radiological severity, it gets classified. Yeah. Zero is no sign of arthrosis. Then you get the minor narrowing of the joint space. Then as you get the joint space get more narrower, yeah, you start the joint become irregular, okay. Then you got beside the pronounced narrowing, there's the irregularity of the joints at the extreme, yeah. And they call symmetrical, the hip symmetrical, then you can start, I will show you. And then you've got the more advanced, then you've got the start the deformity of the joint, the necrosis, the sclerosis, the osteophyte formation, yeah, because you start getting death of the cells, yeah, in the pressure, and the new bones forming try to do a healing. Okay, and that's what you get, yeah. That's the normal joint space. You look at this one, the one on the right, you can see the joint space almost obliterated. You can start seeing the cyst formation, the sclerosis, the bones become wide because you start getting dead bone. Okay, you start getting the osteophyte at the other end, yeah, and then you go to the question. And this is how X-ray looks like. This is the feature. Okay, and you look at the C. You can see the comparative, yeah, on the hip on the right side. When they have a normal, then you get on the left side, yeah, the athletic head. You can see the irregularity of the joint, yeah, on both ends. You can see the cyst, you see the scroll, you can see the head instead of being nice, smooth, like carpet, start irregular. Then you can see the start osteophyte formation. Okay, and that's the treatment. How you treat them, how you treat arthritis. How do you treat arthritis, دكتورة؟ دكتورة بالنص. وبالمي. كلكم بالمي. بالنص. نسيتي راسك. انتي. How are you going to treat arthritis? But arthritis, أنا ما نحكيش عن rheumatoid arthritis. يعني rheumatology. أنا شو rheumatology؟ نحكي arthrosis, arthritis. Degenerative arthritis. How are you going to treat it, دكتورة؟ صلي عليه. في حاجات How are you going to treat it? أنت دكتور. How are you going to treat it? انتوا ليش قاعدين ورا؟ شو حكينا من البداية؟ ديسبلين ما حد يقعد بالاخر 3 كراسي 3 روز مش هيك حكينا بالبداية؟ ليش رجعتوا قاعد تقعدوا 3 روز؟ How are you going to treat headache? How are you going to treat anything? Somebody asked how to treat anything.
أول شيء نتخلص
symptoms خلصنا من undesirable symptoms من البداية. تمام؟ بعدين بشوف حسب الجريد تبع حسب البيشنت كمان.
underlying causes.
هم مش curable.
You need to think systematic, guys. جوابك لازم يكون systematic. If you جاوب هذا, it tells me you are not, brain is not thinking logically. And if you treat, the first thing you treat is conservative. Conservative treatment. Conservative treatment, what you employ? Change of lifestyle, losing weight, modification of activities. Simple thing. Yeah? الناصح بخس وزنه بروح وجعه. مو symptom. بدل تضل ينطنط خفف النطنطة. Modify your lifestyle. Change of habit. And that's 70% of the patients, their symptoms will improve. The next step, huh? Systematic answer.
ممكن السيمتومز لما يجي فترة سيمتومز ممكن نعطيه انسيل مثلا.
قال جوابك لازم يكون systematic.
دكتور اذا ما زبط كونسرفتيف بنبلش انفيسيف ممكن.
Pain
No,
management.
قبل الانفيسيف دكتور.
Pain management.
Systematic answer, guys. Your brain is not working.
اشرح لنا كيف قصدك بسيستماتيك.
اول اشي حكيت conservative treatment. شنو اللي بعديه؟ The group of treatment يكون therapeutics. Then you get to therapeutics. Systems, شو therapeutics? Simple painkiller, non-steroidal, major tranquilizers, and so on حسب severity. How do you treat your headache? No, conservative. تاخذ شاور تروح بتنام.
إذا أخذت شاور بمي سخنة وكان في عندي مثلا مرض ممكن أموت. مش بقدرش أحكي لكل حدا عنده وجع راس روح خذ شاور ونام.
Hello? Hello? How rare is brain tumor? How rare?
إيش بين تو؟
إيش؟
قلت hemorrhage. يكون في عندي headache.
How rare is hemorrhage? الهemorrhage تكون واقعة من جبل. في history.
ممكن كان عنده ساكر انيوريزم كنت سويت له شوية headache.
هيك how rare is psychoaneurysm?
It's not rare. It's not that much rare.
Not that much rare?
It's not that much rare.
It's extremely rare. Extremely rare. How common is headache? How common is headache? Guys, stop thinking stupid ways. Common is common and simple is simple. اللي بصير عنده وجع راس حط راسه بينام باخذ شاور بينام. إذا وجعه كثير باخذ حبة بنادول. And so on. That's what I'm trying to tell you. Then if the headache, as you said, is not a tractable headache, then you go to history, you go to the next stage, the next stage, the next stage, the next stage. Yeah? The next thing is therapeutics. Okay? Therapeutics, big range of therapeutic treatment. Panadol, Panadol joint, anti-inflammatory, blah, 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 steroids. Then we move to invasive. Yeah? Okay? Injection, steroid injection in the joint, for the pain. Then you move to surgery. And you treat it in that systematic way. Whatever الآثار تبعك you must be in that systematic way. مش بس بالأورثوبيديك، بأي شيء. Okay? Then you come to the surgery. Okay? And the surgical treatment, most of the joint, goes systematically again. Okay? You either joint, you either fuse it, yeah? حسب نوع الجوينت وين هو، In other words, you stop the movement, okay? Or you convert the joint to arthritic joint, yeah, fibrotic joint, another joint fibrosis فبيكون بيتحرك بس ما في بين، yeah, بس ما في proper joint، أو you replace the joint. Okay, and again go systematically. حسب الجوينت، هذا big joint. Okay. في الزمانات لما كان يصير عندك تي بي you can't do an implant. ما كانش في implant. شو كانوا يسووا؟ arthrosis. Fuse the joint. Okay. فالوجع يروح والبيشنت يتحرك ويعيش سنين. خاصة الأطفال. إذا صار في تروما والجوينت شو اسمه والمريض ما يتحملش عملية you excise the joint and you convert it to stone joint, fibrous joint. الجوينت بيتحرك الهيد ما في بين بس ما بتصير نفس quality of function. Okay. والultimate والbest you replace the joint. Yeah? Okay. But you can't replace the joint arthritis in the small joint. So we do arthrosis. Yeah? حسب الجوينت حسب السيفيريتي حسب المريض معطيات المريض حسب شو بتطلب. Yeah? تختار له التريتمنت بس you always start conservative with patient lifetime. About physiologic strengthen the muscle around the knee, if the pain goes away, lose weight, etc. مساء الخير. Okay. That's how a hip replacement looks like. Yeah. Okay. Where the head on the replaced with the stem and the top part replaced. So the two parts have to be replaced. Yeah. That's why it's called total hip replacement. In the fracture, we hang up of like half the hip. Yeah. But still have to replace. And then hips, إجمالا two types. Cemented, مثبت cement, أو بدون cement. حسب الإيش وحسب الديزاين الإصلاح. So that's not for you. Okay. And you can see here how the hip will get destroyed, yeah, after a vascular necrosis. Can you see the head, shape of the head? What the shape of the head looks like? You know it's irregular. What it looks like?
مش ثابت مش ثابت
زي ايش؟
ولا
ولا اسمه بيسموه مشروب زي المشروب. Yeah? Okay. زي شكل المشروب. المشروب هيك. Yeah? Okay, you can see كل عفتي the sequence to one. But that's along this standing. Okay. Now, how do I know this is long standing? له زمن طويل وانه مدى بجوز وهو طفل.
في عندي البارت اوف ذا هيب بون.
وش بارت؟ دكتور انا ما تقوليش شو اسمه انا
البيوبك.
Yeah, the pubic bone. You can see the pubic bone is asymmetrical and developed on that side. Yeah? Can you see that? So it's not just the hip, the other bone because it's chronic. Yeah? You can see it's asymmetrical. Yeah? That injury has been for a long time. Thank you. This is what we told you about arthrosis. Yeah? Thank you. This woman عالجتها كانت بتتعب في عمرها 75 سنة. And that's hip fused when she was a child. صار عندها TB وسووا لها fusion. Okay. And she lived at work, but she can't use the hips, تستخدم الني. Okay. فاللي صار مع الزمن الني تبعتها صار عندها arthritis لأنه الضغط كله على الني، كل الحركة على الني. So you move the force أو loading للني وللسباين. إنه بيقدروش يحركوا الهيب، بيحركوا كمان السباين. بصير عندهم arthritis في السباين. But that's how arthritis look like. There's no joint, and you can see the two become like one bone. Yeah? That's arthritis. Okay. نيجي للني كمان again anatomy جديد. Revise the anatomy جديد. Yeah? Go back and read your anatomy, guys. Okay. and all the structure, the ligament, the muscles, yeah? But إجمالا the knee is a 3 joint within a joint, yeah? Okay? What's the 3 compartment in the knee? دكتورة لا فوق تلف يمين وشمال تلف راسك يمين وشمال على صحباتك سامع اشي حد سامعها وقفي سمعيهم ايه الني anatomically كم compartment كم joint 2 3 4 5 6 هاي 7 اوكي 3 شو هم؟ اها lateral compartment اوكي medial compartment lateral compartment والبكتيريوفيمورال yeah and the degeneration will be different degrees yeah حسب الشيب of the leg mostly the medial compartment affected to start with then the vitreoretinal less medial compartment then the central force is in here on the medial side yeah you get more medial well but the end of deformity then you get either okay and you need to go and leave the divide the energy then ask the guys okay بكره اشعه بالكلينيك عمليه السيمينار okay and that's so just to show you how it looks like this is how the meniscus look like yeah on the right on the left side on your left side you can see nice smooth meniscus yeah you all see it nice smooth cartilage and you can see the tear there when you get tear yeah so when you get this is post-traumatic early problem once you start injuring the meniscus start first the meniscus then the main cartilage and so on yeah this is how it looks like arthrosically if you had a bad arthritic knee. Can you all see that? Can you see the difference between this? Look at that femur on this side. What it looks like. Nice, white, shiny, perfect. Yeah? Okay. Look what happened here. You can see the cartilage is now iron. What's the yellow one? What's the yellow? The bone. Yeah? And you can see that's eroded down to the bone. And what's left a few cartilage here and there. Yeah? So that's how it looks like if you do an arthroscopy on this side. Thank you. This is what you get the deformity, yeah? Thank you. As you get the medial compartment, degenerative, yeah? You can see it get narrow and then you get the varus, yeah? Thank you. The rheumatoid tend to get affected the lateral side more. So they get the valgus knees. More common valgus knees. But it can both, but it's common in arthrosis, medial compartment, lateral compartment. But you can see how there's no joint, yeah? And you can see the skeletal changes and the subcontraction changes and the osteophyte. Okay? This is what you can see on the lateral compartment. That's the lateral compartment. You see the difference? And that's what the medial is the lateral compartment. Okay? And again, this is how total knee replacement looks like. Yeah? You get the 2 pieces of metal, and between them is the plastic, special plastic for the metal to move on. And that's why this space. If you see space, yeah, that goes up to the cartilage. And that's how total knee replacement looks like. You can half a knee, a unit called unicompartment. That's a unicompartment, yeah? It's for young people, very young people, muscle athletic, if they have degenerative changes in medial component only, sometimes we replace half of it, not all of it. Partial vertebrae. Okay. But sometimes we do on a shorter in young people. Okay. If the force is like that, okay, it's early disease, if you realign the knee, then you shift the weight from the medial compartment to the lateral compartment. And you can see, once you cut the bone, take a piece out, and realign it, so where the force is going to be, change from the medial compartment to the lateral compartment. Yeah? But they bend it better. Okay? That's corrective osteotomy level. That normally we do it for young people. You don't want to commit to total replacement, and it's one joint, one compartment is affected. Ultimately, they end up with total knee replacement, but at least they buy a few years. Okay? That's the second. Any questions? So you need to go back to the bars and the bars and in the knee. Okay. So you get you a picture of what you're dealing with. Okay. So this is a major joint. Very common couple exams. So you go and revise your anatomy in hips and the knees, so you know it in details. Yeah? Because you're going to be asked about it. It's a very common problem. We get it with the injury, a lot of the x-rays will come around. Go and revise your pathology. Yeah? Okay. You have to fill up the gaps in your knowledge. Okay? And if you don't do it now, it catch you up. When you come to 5 years, 6 years, and start doing exams, you say, oh, and it become too much to go back and forth. So this is a good time to fill up the gaps. Okay? Medicine is accumulative. Yeah? It's accumulative knowledge. It's not just learn one thing and that's it. Okay? بتجمع هون معلومات هون معلومات زي ما حكيت لزملائكم it's like jigsaw. تعرفوا jigsaw? Yeah? تعرفوا jigsaw? Yeah. Very good at doing jigsaw with the age the main clear features. Yeah? Okay? And then fill up the picture. Yeah. So always start with the main ones, pathology, anatomy, yeah, and then you fill up pathology and so on. فبتبدأ الصورة تتوضح. Okay. There's a common mistake to say, oh, I'm not going to be able to read it, so why should I bother? There's nothing in medicine like that. Because what you learn now from the x-rays is going to help you when you do the radiology. When you know the anatomy, you already know now arthritis, spots for arthritis. When you go to rheumatology and medicine, you carry it with you. دكتور هلا لما بحكي على أطفال, if you come pediatrician, then you go and then remember in pediatrics. You follow me? Okay. لما تسوي السباين هون معنا, لما تروح النيورو, تكون عندك تصل معلومات already there, and so on. It's building. It's jigsaw and building blocks. And if you feel a gap, feel big gaps, it's going to collapse on you. One way, one day or another, one way or another.